Alright, we are going to wrap up the lymphatic system here in this video. So we are primarily going to talk about lymphatic organs and different tissues, but we're also going to touch a little bit on autoimmune disorders in this video as well. That might make more sense to have done earlier, but I promise it will tie into what we're doing in this video. Alright, so first up, we have primary lymphoid organs. That's going to be bone marrow and the thymus primarily. So bone marrow, we've talked about this before, about how it is the site of blood cell development. So we touched on this a lot last week when we talked about blood. And so bone marrow is one of our main primary lymphoid organs because it is the site where we are doing hematopoiesis. And so this is primarily located around that spongy bone tissue again. And so this is going to be that site of blood production. So that red bone marrow is found in a lot of our different bones throughout the body. So again, just looking at that hematopoiesis again, we are going to start with that hematopoietic stem cell and start progressing into a couple different pathways. Again, most of our blood cells are in that myeloid pathway, except for our natural killer cells and our lymphocytes, which are part of that lymphoid pathway. Everything else is that myeloid pathway, so our macrophages, monocytes, eosinophils, neutrophils, basophils, and all of our other cell types and platelets are going to come from that myeloid pathway. But we are focusing mostly on these immune cells over here, so starting from about here over are all going to be part of that immune system and lymphatic system. Our other organ, primary organ of the lymphatic system, is again the thymus. This is a bilobed organ found in a small space between the sternum and aorta of the heart. Like I mentioned in a previous video, this is the site where T lymphocytes are going to finish maturing. So they'll start out in that red bone marrow and then migrate to the thymus to finish maturing. But the thymus is most active early on in life, which is when we are initially first exposed to a lot of the different pathogens that humans would be exposed to. This is why kids tend to be little germ factories. They tend to get sick a lot, and people who spend a lot of time around kids are also going to tend to get sick a lot because kids are spreading those germs around a lot. And so the thymus is most active that early stage in life, and after puberty, it is going to slowly start to decrease in activity and size and get replaced with a mix of fibrous and adipose connective tissue. And so we really don't have the thymus as a functional organ and part of the lymphatic system once we reach adulthood. It is pretty much non-existent at that point in time. This is why we don't see it on any of the models or on adult cadavers. For this particular class, it would primarily be seen on a fetal pig dissection. And so we're just not going to see that on adult structures. A couple models I know will come with a thymus gland, but we tend to remove it and not cover it on models because not all models are going to show it. So because we slowly lose function of the thymus over time, you might be wondering, well, then where do the T cells finish maturing? And the short answer to this is we don't really keep making a lot of new T cells once we hit a certain point of time in age. And so, because we're not having this final site of T cell maturation, and so the existing T cells that we have are going to just have to keep making copies of themselves over time in order to have that constant, steady supply of T cells over the course of our life. So the thymus is going to get held right there up by the heart, and it is going to have a lot of blood vessels and nerves located in it. And it's going to have some different parts to it. And it's actually going to have something called the blood thymus barrier, which are going to prevent the cells of the actual thymus from being exposed to antigens circulating through the bloodstream as they mature, because that could cause a lot of issues, because we don't want that getting exposed to a bunch of those antigens. And so we basically have that blocked off from bloodstream circulation in order to keep those antigens out. This is very similar to the blood-brain barrier, which we'll talk about towards the end of the semester when we cover the nervous system, but that's a little bit more familiar to most people than the blood-thymus barrier. But we're kind of operating under a similar idea in both areas. So that's going to be primarily in part of the thymus. Another section is going to have fewer thymocytes in it, but more epithelial cells, macrophages, and dendritic cells. So it can be stained a little bit different, as seen in this image right here. So the medulla and cortex. So it's that cortex that we're trying to block off from the bloodstream, whereas the medulla, it's not quite so important to have that blocked off, and it does stain a little bit lighter in color, as you can see. So any of these lighter areas are that medulla. And so that is going to have the more mature thymocytes. And so that cortex is the immature ones, where we don't want them being exposed to those antigens. But once they've matured fully, they can move out to the medulla and start being exposed to the blood a little bit more and exposure to the antigens a bit more. And so that's also going to allow those cells to exit the thymus and get out into the bloodstream and other lymphatic structures throughout the body. So let's talk briefly about some autoimmune disorders. So like I said earlier, autoimmune disorders are when the immune system starts attacking our own body, normal tissues found in our body that it should not be attacking. We're not really clear yet on exactly how or why this happens. It seems like environmental triggers are a big component of this. For example, there is a instance of something called rheumatic fever, and this is due to an infection with a streptococcus bacteria, which causes strep throat. Not everybody's going to get rheumatic fever, but some people will develop rheumatic fever after a strep throat infection. This was previously known as scarlet fever many years ago, before we knew a lot more about how the immune system works. And basically, the antibodies that are reacting to that bacteria can cross-react with or recognize other tissues in our body as the same thing, specifically certain proteins in the heart that are causing contraction of the heart muscle. And obviously, attacking that heart function is going to be really bad. So this is a very dangerous complication of strep throat. Again, not very common, especially now that we have good effective antibiotics to treat strep throat. The instance of rheumatic fever, at least in richer nations that have ready access to antibiotics, is very low. It does still happen sometimes, but the instance is very low. But damage to the heart, especially the heart valves, is very common. And then there's other theories that having a lot of different common infectious diseases actually prevents autoimmune disorders. So more exposure to infections is going to reduce the risk of having autoimmune disorders, but this is just a theory as of right now. We don't have a ton of evidence supporting that, other than the fact that autoimmune disorders seem not are guaranteed, but they seem to be less common in countries that have higher instances of infectious diseases. But at this point, that is just a correlation. That is a commonality that we've seen. That does not mean it is guaranteed the cause. There could be other reasons that we see lower instances of autoimmune disorders in other countries that have higher instances of infectious diseases. It could be that people are dying from those infectious diseases before they ever have a chance to develop these autoimmune disorders. So we're not really sure if that's actually a real cause and effect relationship, or if it just happens to co-occur and appear that that may be what's going on. But lots of different autoimmune disorders out there. Pictured here in the left-hand side of the screen, this is an x-ray of somebody who has rheumatoid arthritis. So this is when the immune system is attacking the joint tissue. Usually the hands and feet tend to be very, very, very highly affected. And so we start getting this really severe deformation of the hands and stuff as those joints are slowly destroyed. Lupus is another pretty well-known autoimmune disorder. This is much more widespread, and the immune system can be attacking many different systems in the body. No two people with lupus are going to have identical sets of symptoms and identical systems of the body that are being attacked, but this can cause a lot of different disorders and symptoms. So that butterfly rash is one really common symptom in lupus, as it's attacking certain tissues in the face. There can be a lot of inflammation of the heart and lungs, joints, digestive organs, stuff like that. Blood vessels as well can be attacked. So lupus is a pretty widespread generalized autoimmune disorder. There's a lot of others. We've touched on some of these before already. Celiac disease is an autoimmune disorder. This is going to be the immune system attacking the small intestine when it's exposed to gluten. We're very unclear on how that's happening and why that's happening, but research is ongoing. We've talked about diabetes mellitus already. This is attacking beta cells of the pancreas, and so they are not going to produce that insulin hardly at all, and so we're not able to control blood sugar. Graves' disease and Hashimoto's thyroiditis are where the immune system is attacking something to do with the thyroid. So Graves' disease attacks the thyroid stimulating hormone receptor. So there's an antibody that's going to block that receptor, and this is going to lead to hyperthyroidism. So basically this is the immune system attacking these receptors and triggering the thyroid to overproduce those thyroid hormones. Hashimoto's is the opposite. We're still attacking that thyroid receptor, but in this case we are destroying it, and it is going to end up causing low production of those thyroid hormones, leading to hypothyroidism. Myasthenia gravis is going to affect acetylcholine receptors in the muscle junctions. This is going to lead to a lot of muscle weakness, and then we've already talked a bit about lupus and rheumatoid arthritis. So next up are lymph nodes. So we've talked about these already a little bit, but in more detail. Again, we're going to have these lymphatic vessels flowing into and out of it. So these can come into lymph nodes through multiple different ports, but they're generally only going to flow out through one particular vessel. And in our lymph nodes, we're going to have these very densely packed B and T cells, along with macrophages and those plasma cells derived from those B lymphocytes. And this is, again, just a surveillance system, so that we can check all of this lymphatic fluid for pathogens or other debris or mutant cells that should not be present anymore. And so lymph nodes are considered to be secondary lymphatic system organs or secondary lymphoid organs. And so these are just all over the body to help remove debris and pathogens as those filters. And so they'll get destroyed frequently by the cells located here in the lymph nodes. These are roughly bean shaped usually, and they're surrounded by a very tough capsule of dense connective tissue. They are compartmentalized, so we do have segments in them. Which are extensions of that capsule. And then we have some other reticular fibers offering more structural support so that we can have space for all of these cells to exist and space for that fluid to continue getting in. We've also got those valves, again, very, very close to the actual lymph node and leaving the lymph node so that we're not getting backflow of that lymphatic fluid. And that's going to be our filter site. So we've got an actual tissue section over here of a lymph node. So that's what it looks like. The medulla here deep down inside is going to be the main location. A lot of the cells that we're finding here, all of those lymphocytes, macrophages, and dendritic cells. And then we can just kind of see out here where some of those lymphatic vessels would be coming into the actual lymph nodes themselves. Way too far there. All right, next up is the spleen. So the spleen is covered this week with the digestive system, but it is a lymphatic organ rather than a digestive system organ. It's just located close to the digestive system. So this is going to be located up under the diaphragm, as you can see here. It's going to be on the left-hand side of the body. This is also going to be made up of a lot of that reticular fibers and dense irregular connective tissue. We're also going to have this divided into nodules as well, just like a lot of other organs. But we are getting a lot of blood flow into the spleen, and I mean a lot of blood flow into the spleen. So it enters via the splenic artery. That's going to split into a lot of different arterioles and then into sinusoid capillaries. So those are these capillaries that have big missing pieces of cells, so very, very large openings so that blood can get out into the tissue of the spleen itself. And it will eventually collect into venules that drain into the splenic vein and then return into circulation through that hepatic portal vein. And so the nodules of the spleen are going to have a large area of something called red pulp. So we can see that represented over here. This red pulp surrounding the sinusoid capillaries is called red pulp because this is mostly erythrocytes, so those red blood cells. And it's also going to have some reticular fibers and certain macrophages mixed in there, a few lymphocytes, but not a ton. Its main job is to get those worn out red blood cells out of circulation, as well as dealing with any bloodborne pathogens that might come through. And so that's the main job of the red pulp. And then we also have white pulp, as you can see here. This is going to not have the erythrocytes found in the red pulp, and it's going to, as you can see, very closely surround a lot of these arterioles, but not the veins, mostly just the arterioles. And it's going to look very, very similar to the lymph nodes, and it's going to have a lot of what are called germinal centers. So this is where a lot of B cells are going to be actively dividing and making copies of themselves, so that clonal expansion. And it's also going to have T cells, macrophages, and dendritic cells located in there as well. And this is where a lot of the T and B cells are being activated as part of that overall immune system response. We also have a marginal zone, which is the transition between red and white pulp. And that is where some of those functions will mix. So this isn't a super defined marker in between these two areas. There is a little bit of that transition area. Tonsils are going to be something called a lymphoid nodule. So we have three main tonsils. They are being covered in the digestive system this week because they are located in a lot of the digestive organs and function partially with the digestive system, as well as the respiratory system and lymphatic and immune systems as well. So these are going to be located up in the pharynx again, that pharyngeal tonsil up there. We have the palatine tonsils. These are the ones that you can see when you look in the mirror at the back of your throat. And then we have the lingual tonsil at the back of the tongue, at the back of that oropharynx area. And so we've got a lot of these to be kind of surveilling the air we breathe in and the foods that we eat and stuff like that. And so these tonsils can swell during active immune responses. And so that's why a lot of those tonsils get swollen. That's how we get sore throats and stuff like that. And so these are going to, again, be containing a lot of different immune system cells. The pharyngeal tonsil up here is also sometimes called the adenoid, and so you may have heard adenoid before. Some people do have their adenoids shaved down because they have a hard time breathing because it's so large and inflamed, usually due to just general inflammatory responses rather than an active infection, so that can happen. I have a friend from high school that had that done. And was able to breathe way better after that. So it was not removed fully, but it was partially removed. So tonsils don't actually have a full capsule containing them, and so the epithelial tissue found up here in the nose and mouth are going to kind of blend with part of that capsule and the tonsil tissue itself. And then we also have a lot of crypts, so these depressions in the tonsils, which is going to allow certain materials to accumulate, which is going to help encourage pathogens to get deep into that tissue where we have those germinal centers of B and T cells, which are then going to learn to recognize those and start actively destroying them. This happens especially in children, so they tend to have a lot more tonsil problems than adults do. But once we reach adulthood, we tend to have fewer tonsil problems, especially with massive inflammation. But if it does happen, that's usually when the tonsils are removed, is because they're causing more issues than they are actually being helpful. So it used to be that we removed tonsils a lot, especially the palatine tonsils, at any slight sign of problems, and then we realized they were an integral part of the immune system, and so we started leaving them unless they were actively causing more harm than they were doing good for our body. Next up is mucosa-associated lymphoid tissue, or MALT. This is found specifically in the mucous membrane epithelial. It's found in really, really high numbers in the gastrointestinal system, but it's also found elsewhere in breast tissue, the lungs, and eyes. MALT found in the small intestine is specifically Peyer's patches, which are indicated here. And that's going to be an immune response against ingested substances that do make it into the small intestine. These have very, very specialized cells that are going to sample from the actual intestines themselves and transport it to nearby follicles for those adaptive immune cells to mount their response. And that wraps up chapter 19 on the lymphatic and immune system.